When it comes to men's health, most of us think about fitness, hormones, and maybe diet, but very few realize that something as ordinary as a pill in your medicine cabinet could be quietly influencing your sexual performance and penile health.
Yes.
I'm talking about medications that can have unexpected effects on your erection, sensitivity, and even your desire. Let's start with one of the most common categories, antidepressants. These medications are incredibly valuable for mental health, but many of them, especially SRIs, can alter your brain chemistry in a way that reduces libido or delays orgasm. It's not a sign of weakness or a permanent change. It's just chemistry. The good news is, if you're experiencing these side effects, your doctor can often adjust the dose or switch you to a different medication that balances your mental and sexual health more effectively. Next, blood pressure medications deserve attention. They protect your heart and arteries, but erections are also all about blood flow. If a drug reduces your vascular response, you might notice weaker or slower erections. Not every medication in this category does this. Some are more neutral, so if you're concerned, it's worth having an open and honest conversation with your healthcare provider. Then there are medications for prostate health and hair loss. Many men use drugs like finasteride without realizing they work by blocking testosterone conversion. While they're effective for their intended purpose, this mechanism can sometimes lower libido or affect erectile strength. These effects don't happen to everyone, but it's crucial to be aware so you can make informed decisions. You might not expect this, but some antihistamines, painkillers, and even sleep aids can also dull nerve sensitivity or reduce blood flow over time. Add recreational drugs or frequent alcohol use into the mix, and you have another layer of stress on your sexual function. Your penis is extremely sensitive to changes in blood supply, hormones, and nerve signals, so even small chemical shifts can make a noticeable difference. The key takeaway here is awareness. Never stop any prescribed medication suddenly. That can cause more harm than good. Instead, talk to your doctor about what you're experiencing. There are almost always safer alternatives, dosage adjustments, or additional therapies that can restore balance. Your penis health is a reflection of your overall health, physical, hormonal, and emotional. So next time you think about what might be affecting your performance, don't just look in the mirror, look in your medicine cabinet too. Knowledge and communication are the best medicine of all. When we talk about men's health, we often focus on the gym, diet, or testosterone levels, but there's a hidden factor that can quietly influence your sexual health and performance. The medications you take every day. It might surprise you to learn that some of the most common prescriptions, even over-the-counter drugs, can affect your penis health in ways you'd never expect. The reason is simple yet important. Your erections depend on healthy blood flow, balanced hormones, and sensitive nerves. Any medication that interferes with these systems can have an impact on your ability to perform, your libido, or even the way your body responds to arousal. Let's start by understanding the basics. An erection is a complex process involving your brain, hormones, blood vessels, and nerves. It's not just about desire, it's about coordination within your body. Certain medications, even those designed to help with other health conditions, can unintentionally disrupt that coordination. For example, drugs that lower blood pressure may improve heart health, but they can also reduce the force of blood flow to the penis. Without that strong rush of blood, maintaining an erection becomes more difficult. That doesn't mean you should stop taking your medication. It means you should know what's happening and talk to your doctor if you notice changes. Antidepressants are another category worth discussing. They are essential for millions of men dealing with anxiety or depression, but they work by altering the brain's chemical balance, particularly serotonin. When serotonin levels rise too much, it can suppress sexual desire and delay or prevent orgasm. It's frustrating, especially because these drugs are often needed for mental stability. The encouraging news is that these side effects aren't permanent. With proper medical advice, there are ways to adjust dosage or switch to medications that have fewer sexual side effects. Now, let's consider hair loss and prostate medications. Drugs like finasteride are commonly prescribed to prevent baldness or shrink an enlarged prostate. They work by blocking the conversion of testosterone into a more potent form called DHT. While that can be helpful for hair and prostate issues, it sometimes comes with a cost, reduced libido or erectile strength. This doesn't happen to everyone, but for those who experience it, it can be discouraging. It's another example of how interconnected your hormonal system really is. Even over-the-counter drugs can play a role. Antihistamines for allergies, certain painkillers, And sleep medications can subtly affect nerve sensitivity or circulation. If you add lifestyle factors like smoking, alcohol, or recreational drugs, the effect can multiply. Your penis is like a barometer for your body's overall health. When it's not functioning as well as it used to, that's your body's way of signaling that something needs attention. The real message here is awareness and communication. Many men suffer in silence because they feel embarrassed or unsure, but understanding that medications can influence sexual health is empowering. You don't need to choose between treating one condition and losing another part of your well-being. With the right medical guidance, balance is absolutely possible. Always talk to your doctor, never stop medication abruptly, and remember, taking control of your health starts with knowing your body and listening to it carefully. When we think about antidepressants, most of us see them as medications that help with emotional balance, anxiety relief, or mental clarity, and that's absolutely true. These medications are powerful tools that can transform lives by stabilizing mood and helping people manage depression or anxiety disorders. But what many men don't realize is that antidepressants can also have an unexpected effect on their sexual health, particularly on libido, erections, and even orgasm. This isn't something to feel embarrassed about. It's a well-known medical reality that deserves to be understood, not feared. The main reason antidepressants can influence sexual performance lies in how they interact with the brain's neurotransmitters, especially serotonin. Many antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, work by increasing serotonin levels to improve mood and reduce anxiety. While that's incredibly beneficial for emotional stability, high serotonin can also suppress dopamine, which is the chemical linked to pleasure, reward, and sexual desire. When dopamine is reduced, libido often drops, and it can take longer to get or maintain an erection. For some men, reaching orgasm becomes difficult or delayed, something called delayed ejaculation. This doesn't mean that antidepressants are harmful or should be avoided. Mental health is deeply connected to sexual health, and treating depression can often improve your energy, confidence, and interest in intimacy overall. However, it's important to recognize that side effects vary between individuals and between different types of antidepressants. For example, while SSRIs are more likely to cause sexual side effects, other classes such as bupropion or mirtazapine tend to have fewer sexual impacts and may even improve libido for some users. That's why having an open discussion with your healthcare provider is essential. If you're taking antidepressants and noticing changes in your sexual function, the first and most important step is to communicate. Don't stop your medication abruptly. Stopping without medical supervision can cause withdrawal symptoms or worsen depression. Instead, your doctor may recommend adjusting the dose, switching to another medication, or adding something to counteract the side effect. Sometimes lifestyle changes like exercise, healthy diet, stress reduction, and better sleep can also make a huge difference in restoring sexual balance. It's also worth noting that depression itself can lower libido, independent of any medication. So if you're struggling with low energy or disinterest in sex, it's not always the antidepressant. Sometimes it's the underlying condition being treated. Once the mood begins to improve, sexual desire often follows. However, if the medication side effects remain persistent even after emotional recovery, then it's a sign that your treatment plan might need tweaking. The key takeaway here is that sexual side effects from antidepressants are common but manageable. You are not alone, and you do not have to choose between mental wellness and sexual vitality. Both are possible with the right guidance. A healthy mind supports a healthy body, and vice versa. The most important thing is to stay informed, be honest with your doctor, and remember, managing your health is a journey, not a single step. Blood pressure and heart medications are among the most commonly prescribed drugs worldwide, helping millions of people live longer, healthier lives. They play a vital role in preventing strokes, heart attacks, and other serious cardiovascular events. However, one of the lesser-known effects of these medications is their potential influence on men's sexual health, especially on erectile function. The connection may not seem obvious at first, but when you think about it, it makes perfect sense. Erections rely on healthy, unrestricted blood flow to the penis, and any medication that alters circulation can potentially impact that process. To understand this, it's important to remember how an erection works. When you're aroused, your brain sends signals to the blood vessels in your penis to open up, allowing more blood to rush in and stay there until climax. Blood pressure medications, particularly beta blockers and certain diuretics, are designed to relax and open blood vessels or reduce blood volume, which in turn lowers blood pressure. While this is beneficial for your heart, it can sometimes reduce the pressure and flow needed for a firm erection. It's not that these medications directly damage the penis, rather, they change how blood moves through the body. However, not all blood pressure medications have the same effect. Some classes like AC inhibitors or calcium channel blockers are less likely to interfere with sexual performance. In fact, certain newer medications are more neutral or even slightly beneficial for erectile health. That's why it's so important to have open communication with your healthcare provider. If you're experiencing erectile difficulties after starting a new medication, your doctor can often switch you to an alternative that maintains your heart health without compromising your sexual confidence. It's also worth mentioning that the underlying heart condition itself can contribute to erectile issues. High blood pressure, clogged arteries, and poor circulation all limit blow to the penis, sometimes even before symptoms show up elsewhere in the body. In fact, erectile dysfunction is often one of the earliest signs of cardiovascular disease. So while it's easy to blame the medication, it's equally important to address the root cause, your heart health. When the blood vessels are healthy and strong, both your heart and your penis benefit. Lifestyle factors play a big role here too. If you smoke, drink excessively, or live a sedentary lifestyle, these habits can amplify the side effects of your medications. On the other hand, regular exercise, a diet rich in fruits, vegetables, and healthy fats, and managing stress can dramatically improve both heart and sexual function. The key point to remember is that you should never stop taking your blood pressure medication without your doctor's advice. Doing so can be dangerous and may lead to serious complications. Instead, talk about what you're experiencing. Modern medicine offers many options that can protect your heart while preserving your sexual vitality. Remember, good health is all about balance, and your sexual well-being is an important part of that equation. Hair loss and prostate medications are among the most commonly used drugs by men over the age of 30, but very few realize how they can impact sexual health. Medications like finasteride and dutasteride, often prescribed for hair loss or benign prostatic hyperplasia (BPH), work by altering how testosterone is processed in the body. While they are effective at reducing hair thinning or shrinking an enlarged prostate, they can sometimes lead to changes in libido, erection quality, and even sensitivity. Understanding how these drugs work is the first step toward making informed decisions about your health. These medications belong to a class called upre-5-alpha reductase inhibitors. They function by blocking the enzyme that converts testosterone into dihydrotestosterone (DHT), a stronger form of the hormone responsible for hair loss and prostate growth. While lowering DHT can help maintain a fuller head of hair or relieve urinary symptoms, DHT also plays a significant role in sexual function. It supports libido, contributes to erection strength, and maintains the tissues of the penis. When its levels drop too low, some men may notice reduced desire, softer erections, or changes in orgasm intensity. It's important to emphasize that not everyone experiences these side effects. Many men take these medications without any noticeable changes. However, for a small percentage, the effects can be more persistent, sometimes even continuing after stopping the medication. A condition sometimes referred to as post-finasteride syndrome. The science around that is still being studied, but it's a reminder that every body reacts differently. If you're taking hair loss or prostate medication and begin to notice changes in your sexual performance, it's essential to talk openly with your doctor. There might be other treatment options available, such as topical formulations or lower dosages that still provide results while minimizing side effects. It's also worth discussing whether lifestyle adjustments, such as better nutrition, stress reduction, or hormone balancing through natural methods, could help restore equilibrium. Another point to consider is the psychological aspect. Hair loss itself can affect confidence and self-esteem, which are both important for a healthy sex life. So it's possible that some of the perceived sexual issues may stem from emotional stress rather than purely hormonal changes. This is why managing both the physical and psychological sides of health is crucial. For prostate issues, medications like finasteride can be incredibly helpful in improving urinary flow and reducing discomfort, but they must be balanced carefully. Sometimes combining lower doses with lifestyle strategies such as regular exercise, maintaining a healthy weight, and reducing alcohol intake can provide the best of both worlds: symptom relief and preserved sexual function. Ultimately, the goal is not to avoid these medications altogether, but to use them wisely and with full awareness. Every treatment has benefits and potential drawbacks, and knowing how they affect your hormones allows you to make informed decisions. If you ever feel a change in your sexual health after starting such medication, don't ignore it. Speak up. Open conversation with your doctor is the most powerful tool for protecting both your confidence and your overall well-being. Many men assume that only prescription medications can affect their sexual performance, but the truth is that over-the-counter drugs and recreational substances can also have a surprising impact on penis health. Whether it's something as common as an allergy pill or as routine as a pain reliever, these seemingly harmless medications can quietly interfere with blood flow, nerve sensitivity, and hormonal balance. Over time, they can make it harder to achieve or maintain an erection, reduce sensitivity, and even affect overall desire. Understanding which substances have these effects and why can help you make smarter choices for your body. Let's start with over-the-counter antihistamines. The type you might take for allergies or sinus congestion. These medications work by blocking histamine receptors to stop sneezing and watery eyes, but histamine also plays a small role in sexual arousal. By blocking it, antihistamines can reduce blood flow and make it more difficult to achieve an erection. The effect is usually temporary, but if you're taking them daily for allergies, it can become more noticeable over time. Painkillers are another common culprit. Medications like ibuprofen, naproxen, and other nonsteroidal anti-inflammatory drugs, NSAIDs, are excellent for managing pain and inflammation, but long-term use can affect how your blood vessels respond to stimulation. They can also interfere with prostaglandins, chemicals that help blood vessels expand, an essential step for an erection. While occasional use is generally safe, daily or high-dose use may begin to dull your body's natural responses. Sleep aids and sedatives can also influence sexual function. These medications, including some that contain diphenhydramine or melatonin, help you relax and fall asleep, but they can also lower your body's arousal response. Because they slow down the nervous system, they may reduce the sensitivity needed for arousal or orgasm. In men who use them frequently, this can create a pattern of fatigue, low libido, and weaker erections over time. Now let's talk about recreational substances, alcohol, nicotine, and other drugs. Alcohol is perhaps the most common substance linked to erectile issues. While a drink or two might make you feel relaxed, alcohol acts as a depressant on the nervous system. It slows down the signals between the brain and the body, which can make it harder to stay aroused or maintain an erection. Chronic drinking can also lower testosterone levels and damage blood vessels, making the effects even worse over time. Nicotine, found in cigarettes and vaping products, constricts blood vessels, reducing the flow of blood to the penis. Even if you're young and otherwise healthy, smoking can have an immediate negative effect on your erections. Recreational drugs such as marijuana, cocaine, and opioids can disrupt hormone levels, dull sensitivity, and interfere with blood flow. The more often they're used, the more significant the impact tends to be. The key message here is awareness. Many men overlook the everyday substances that could be affecting their performance because they don't seem dangerous. But small daily choices can have lasting effects on your sexual health. If you notice changes, review what you're taking, even over-the-counter pills, and discuss them with your doctor. Sometimes simply adjusting dosage, timing, or finding natural alternatives can make all the difference in restoring your confidence and vitality. When it comes to medications and their effects on penis health, awareness and communication are absolutely essential. Too often, men experience changes in their sexual performance, libido, or sensitivity and assume that it's just part of aging or stress. In reality, it could be linked to a prescription or even an over-the-counter drug they're taking regularly. The most important thing to understand is that these effects are not a sign of weakness, nor are they something you have to simply accept. They're signals from your body, and by paying attention to them, you can take meaningful action to protect both your sexual health and your overall well-being. The first and most critical rule is never to stop taking a prescribed medication without consulting your doctor. Many drugs, especially those for blood pressure, mental health, or hormone balance, are designed to work gradually and maintain stability in your body. Stopping them suddenly can cause serious health risks like heart problems, withdrawal symptoms, or sudden mood changes. Instead, bring up your concerns during your next appointment. Doctors are used to these discussions. They won't judge you, and they'll appreciate that you're taking charge of your health. There are always alternatives, whether it's adjusting the dosage, switching to a different medication, or combining treatments with supportive therapies. It's also important to look at your body as one interconnected system. Your sexual performance depends on healthy blood vessels, steady hormone levels, and clear nerve signals. all of which can be influenced by your lifestyle as well as your medications. So if you're dealing with changes in your sexual function, think about your habits too. Are you getting enough exercise? Are you sleeping well? Are you managing stress effectively? Regular physical activity can improve circulation, balance hormones, and boost mood, all of which directly enhance sexual health. A diet rich in fruits, vegetables, lean proteins, and healthy fats supports your cardiovascular system and keeps your body strong from the inside out. Equally important is your emotional health. Stress, anxiety, and lack of communication with your partner can amplify the effects of medication on your sexual function. If you're feeling disconnected or anxious about your performance, that emotional tension can make the physical symptoms worse. Practicing relaxation techniques, mindfulness, or simply talking openly with your partner about what's happening can relieve a lot of pressure and help rebuild confidence. Another useful step is scheduling regular health checkups and blood tests. Tracking your hormone levels, cholesterol, and blood pressure helps you and your doctor understand the bigger picture. Sometimes a small adjustment in one area can restore balance in another. Ultimately, maintaining penis health while on medication comes down to being proactive, informed, and patient. Your body is resilient. It responds positively when treated with care and attention. Don't ignore changes, but don't panic either. By understanding the connection between your medications, your lifestyle, and your sexual health, you can work with your doctor to find the right balance. Awareness is power, and when you use that power wisely, you protect not only your sexual vitality, but your confidence and quality of life for years to come. In the end, your sexual health is not just about performance, it's a reflection of your body's overall well-being. Every system in your body, from your heart and hormones to your brain and blood vessels, plays a part in keeping your penis healthy and responsive. Medications, whether prescribed or over-the-counter, are meant to heal or manage health conditions, but sometimes they create side effects that quietly affect your intimate life. The key is not to ignore these changes or feel embarrassed about them, but to understand what's happening and take control of your health. Your body has a way of communicating. When something feels off, it's trying to tell you to pay attention. The solution is never to stop a medication on your own, but to have an open, honest conversation with your doctor. There are always safer options, different dosages, or alternative treatments that can help you feel like yourself again. Health isn't about sacrifice, it's about balance. You can have strong mental health, a healthy heart, and a satisfying sex life all at the same time when your treatment plan is tailored to you. Remember, your penis health is a mirror of your lifestyle, your circulation, and your emotional state. If you're taking care of your body, nourishing it with good food, regular movement, and enough rest, you're already supporting your sexual vitality. And if you're mindful about the medications you take, knowing how they work and how they might affect you, you're empowering yourself with knowledge that most people overlook. So let's stop treating sexual health as a taboo and start seeing it as an essential part of overall wellness. Talk to your doctor, stay informed, and never hesitate to ask questions about your treatment. Because when you understand your body, you take control of your confidence, your health, and your future. Your vitality is worth protecting, every single part of it.